Hey, what's up, everybody? It's Kenny Lamons here with Medicare Millennials. Today, I'm going to try to do a short and concise video, mostly for new Medicare agents, regarding this AHIP certification that you likely keep hearing about. I'm going to try to do this. I'm just going to hit all of the highlights, the most important key things about it, some tips on how to pass it, where to get a discount. And if you have any more questions, just go to our website, MedicareMillennials.com, and you can reach out to us there. Just make sure if you reach out to us using that little reply thing, that you give a little bit of background, just some kind of context on what you're looking for, so that we don't waste your time, you don't waste ours, that kind of thing. All right, great. Let's jump into it. Okay, so what is AHIP? AHIP is actually an organization, okay, that administers at a cost the Medicare fraud, waste, and abuse training that is necessary for Medicare agents to be certified to sell Medicare Advantage and Part D products, okay? So actually, you can get your Medicare fraud, waste, and abuse training at a couple of other places, NABIP and so on, but most people are going to get it through AHIP, okay? So their website, you just go to ahip.org. You'll see Medicare fraud, waste, and abuse training for agents. You can go to it there. However, don't do that yet. I'm going to tell you another way to get to it so that you can save some money. So that's what this is. Now, who has to have it? So this annual certification, which means that there is a new certification for each calendar year. So what just came out now is that, looking ahead, it's the 2024 certification for Medicare fraud, waste, and abuse. So who has to have it? Anyone who would like to sell and market Medicare Advantage products or Part D prescription drug plans for the calendar year 2024 has to have this certification. So if you're going to sell some Medicare Advantage plans during AEP this year, October 15th to December 7th, you need your 2024 AHIP certification. If you're going to sell Medicare Advantage plans this year, let's say somebody turning 65 next month, you need the 2023 AHIP certification. So if you're brand new and you're getting into this, want to sell right now for the next couple months, got to get 2023, then do it again immediately for 2024. Okay? So keep that in mind. It's per calendar year. Who else needs it? Agents who have already sold Medicare Advantage or prescription drug plans. Maybe they don't intend to sell anymore next year, but they want to continue to receive their renewal commissions. If that's you, to continue to receive your renewal commissions for any of those plans you sold that are renewing for 2024, still have to take this certification. Okay? So I think that gives us a good idea on who needs it and what it is. Now let's break down what it consists of real quickly. There is a $175 charge to take the modules, the practice test, the final test, and the fraud, waste, and abuse to get the certification. $175. If you go straight to the AHIP website, that's how much you're going to pay. If you go through your FMO, there could be a discount through them. If you don't have an FMO or you're looking for a new one, feel free to reach out to us. I'll recommend who I use and trust and know. Depending on your situation, I'll at least provide you some guidance, okay? Or what's more common is you go through the carrier. So I'm going to use one example. The carrier is the insurance company that you plan to sell and represent their plans. If you contract with Humana, you log into the Humana Vantage agent portal and click certify or recertify. From there, as you're going through to do their individual certification for Humana, for example, they'll have a link to go to AHIP, create an account or log in, and they will automatically apply a $50 discount, bring that cost down to $125. So if you're a new agent trying to pinch every penny you can, don't blame you. Go through your FMO or through one of the carriers, Humana, United Healthcare, so forth, instead of going directly to ahip.org to log in and register for the certification. Okay, so that's the cost. You're going to go through 5 modules covering marketing, Medicare Advantage health plans, prescription drug plans, eligibility and enrollment. Very important information that's coming straight from the horse's mouth. So all the questions are like, well, is Medicare too complicated? Are the marketing rules too strict? Am I going to be able to comprehend all these moving pieces? Well, take the time and go take the AHIP. And if on the other side of it, you feel like you understand it better, then you might love this industry because you're going to be an advisor. You know more than 90% of agents just for taking your time on the AHIP already. If you get to the other side of the certification, you're more confused than when you started. Maybe you just do stick to final expense. Maybe you just don't like all of the moving pieces that have to do with Medicare. Those are the 5 modules. You're going to learn a lot through those 5 modules. You'll take a practice test at the end of each module, unlimited attempts on those practice tests. So this is what's going to teach you how to pass the final exam. So after you do the 5 modules, redo those practice tests, take your time in each of the slides, take your time on the practice test, redo each practice test. Then you'll be ready to take the final exam. It's 50 questions timed, and you have to score a 90% or higher. So you can't miss more than 5 questions. You get 3 attempts. Some carriers will allow 6 attempts, but to be safe, you need to do this within 3 attempts. Score a 90% or higher on this 50-question exam. If you actually took your time, studied the slides, and redid each practice test a couple of times, you're going to be able to pass this with a 90% or higher. Don't be intimidated, guys. Let it be a barrier to entry for somebody else, okay? You go through the 5 modules. I don't care if it takes you 5 hours or 25 hours or longer. Slow down and learn, and you'll be able to pass that final exam. Once you do the final exam, you're almost done. You'll click on through to the fraud, waste, and abuse portion, which is shorter, simpler, easier. Then you've completed your AHIP or Medicare Fraud, Waste, and Abuse certification through AHIP. It will link that directly to the carrier website. So if you went through Humana's link, it's going to automatically send that back. Then when you log into United Healthcare to do your United Healthcare annual certifications, it will link back to United Healthcare. You don't have to pay a separate cost for each carrier, okay? So once you've done it once, you paid the $125 after discount, it will automatically send out as you log in to do your certifications with each carrier. Don't have to pay for it multiple times. Okay, so now that's the main thing about AHIP. Let me give you a couple of tips and tricks and kind of pointers. Number 1, at the end of the exam, or after you do the certification, it's going to ask you if you want to pay extra, I can't remember how much it is, to get continuing education credit. Well, in the state of Texas, we need like 24 hours every 2 years of continuing education. I believe you get 6 hours by buying the CE credit. So all that time you spend on AHIP will give you 6 continuing education hours towards your life and health license renewal. At least in the state of Texas, I believe in most states, there's that same requirement. I encourage you to do that. Take advantage of that 6 hours. That's less time you have to put into your renewal. Second, I don't care if you're brand new or if this is your 2nd, 3rd, 4th, 5th, 6th, 7th, 8th time recertifying through AHIP. Slow down, take your time. I learn something new in every module every year. They're always changing things, and there's always things that you never quite understood, maybe because it hasn't been prevalent and you're just in the scope of what you've been doing so far, but maybe now it is. Maybe there's MSA plans now in your area. Even if you don't sell them, you want to sound intelligent and be able to talk about them, right? And so slow down. Learn the material from AHIP. It's actually extremely valuable. You will be an expert when it comes to Medicare Advantage and prescription drug plans if you take your time and really learn the AHIP. Next, if you're only going to sell Medicare supplements, or you're only going to sell which should be obvious, but life insurance, hospital indemnity, cancer plans, you don't have to get AHIP certified. You only need this certification to market and sell and receive renewal commissions on Medicare Advantage plans and Part D prescription drug plans. Okay, so you don't have to do it other than that. I hope that was helpful, guys. I tried to cover as much as I could. Good luck on 2024. We got a big year coming up. I'll be putting out a lot of new content to help you guys out and share what I've got going on. See you later.